I'm Beth Ann Berliner from REL West at WestEd, and I'll be kicking things off. We have a lot of good information to cover in one short hour. Our goals are for you to learn more about chronic absence research, to better understand chronic absence in Fresno County, to gain a deeper knowledge about evidence-based approaches for addressing chronic absence, and to preview upcoming learning opportunities for you and Fresno County colleagues. Just as a real quick overview of the agenda, we're going to address some challenges and opportunities in Fresno County, ways to reduce chronic absence, and describe an upcoming local event and forming a community of practice for reducing chronic absence. So there's going to be a lot more on both of these opportunities to follow. So just really briefly, this work is sponsored by REL West at WestEd, where I work. It's one of 10 national education labs funded by the Institute for Education Sciences at the U.S. Department of Education. We work in California, Arizona, Nevada, and Utah, and partner with a number of districts and organizations, including many in the Central Valley, for research and practice. I'm pleased to introduce our presenters, Manuel Escandon, who, as you know, is the director of the Department of Student Intervention and Prevention at the Fresno County Superintendent of Schools, and Hetty Chang, the founder and executive director, and Cecilia Leon, the director of programs at Attendance Works, the nation's leading voice for reducing chronic absence. Manuel, you're on.
Okay, good morning, everyone. Welcome to the first of a few sessions we're going to be having. I just want to thank the people who are putting this on, and I'm looking forward to everyone joining us here at the DoubleTree in Fresno on the 23rd of January, and then we break into our 3 following webinars. As you know, everyone in our area is doing an amazing job addressing chronic absenteeism, but we're still, with the latest data that's embargoed till December 9th, I'm not going to use direct numbers, we're about a 0.5% from the statewide average. Those of you who know me, you know how I feel about averages, because it's, you know, you could read those either way. But again, I'd like to thank everyone for joining us this morning and commend you on all the great work you're doing in your districts. But we still have a lot of work to do as we work with these TK and K kids, and understanding that for some purpose, you know, for the dashboard, it's only K-8 that we're looking at. But all of us, for student achievement purposes and program, we're looking at TK through 12. So all of you have received the email where today we're going to do a 45-minute to an hour webinar on January 23rd. We'll have the convening here. I encourage you to bring your entire team. I'm hoping we can get 200 or 300 people. We're talking to media to make sure they cover it, because really, and all of you know this, it's coming down to working with our parents, and whether it's addressing mental health concerns or whatever issue they have, it's about our districts addressing those concerns so they can send their child to school. Again, I want to thank REL West and Attendance Works. They're the experts, but we have a lot of experts here in Fresno County also, but to working with us, because this is the first time they've came down to our area and worked with us as a whole. I know they've worked with certain districts, but this is the first time where they're getting us all together, and we're going to do some great work in the spirit of collaboration, and it's free. And when I say that, it's free, but please make sure, if you register 30 or 40 people, the idea is to get 30 or 40 people to attend, because sometimes, you know, because it's free, people don't show up. So I know I'm preaching to the choir here. You can bring in as many people as you want. Let's just make sure they get those timely reminders that on January 23rd at the DoubleTree here in Fresno, we're going to have an amazing day, and they're going to get well fed, and we're going to do a lot of great learning. And now I introduce Heidi Chang.
Thank you so much. It is my pleasure to join you. Thank you so much, Manuel and Beth Ann, for creating this opportunity to work together. Attendance Works, just so folks know, we are a national organization, but we have deep roots here in Cecilia and I and other members of our team, we actually I have Maria Casey and Molly. A number of us have actually lived in California a long time, and California is the site of where we first started doing this work. Attendance Works is really a giveaway strategy. I hope many of you have been on our website, but what our goal is to make sure that all of you can not reinvent the wheel, but leverage what already exists from what we're learning across California and in other parts of the country, so that you can advance more effective practice, you can engage in meaningful and effective communication. We use that information to encourage a wide range of researchers, including many here in California, to make sure that we know really what works. We help take the research questions we see from the field to get them to have research that's relevant to practice. And then we help people think about what are the implications for policy. And I will say that we really, before we existed, no one knew that chronic absence was really a metric that they should be tracking. So we are, I don't know, to blame or give credit for the fact that we have chronic absence as an accountability metric in most states in the country, including here in California. So let me talk for a moment about what is chronic absence. Because really, this is actually a relatively new metric. We haven't been having it in place for that long. We've typically looked at truancy here in California and elsewhere, which is really referring to unexcused absences, or average daily attendance, which is how many students show up to school each day. Chronic absence is a different metric. It's looking at who's missing so much school for any reason, whether it's excused absences, unexcused absences, or suspension, that they're academically at risk because they've missed so much time in the classroom. It really acts as an early warning sign. That's why we have a missing 10% or more, because then you can notice just 2 days a month, 2 days in the first month, 4 days in the second month, and take action to get kids in school before they are academically behind. You know, when we first started this work, the green slide with the 95% average daily attendance is Oakland, California. And you can see even with 95%, where most people think that's an A, we were seeing schools with as much as 16%. I've actually seen even higher than that levels of chronic absence. And then in some places where you have a 90% average daily attendance, you'll see as high as 25% of your kids chronically absent. And when chronic absence is that high, it's actually affecting the learning for everyone in a school or a classroom, because the churn is creating challenges for teachers about whose academic need do they meet. When we look at average daily attendance, imagine a school with just 200 kids. If you only had 10 kids who missed school every day, you'd have 95% average daily attendance. It's not the same 10 kids who miss every single day. If those same 10 kids never showed up throughout an entire school year, they probably wouldn't be there. It's not a 5% problem. You have 200 kids in a school, 180 days in a school year, that's 1,800 absences. You could have 50 kids, each of whom missed 20 days of school, which makes them chronically absent. And you'd have a 25% chronic absence challenge, right? So average daily attendance can easily mask chronic absence. This is actually data from San Francisco Unified. I actually live in San Francisco. This is where my kids went to school. And when they first calculated chronic absence, this is the curve they got. What do you notice? You know that if you only looked at 10 unexcused absences, and at that point, a kid would be qualifying for a SART, right? They would have had 3 knots. You would, in kindergarten, miss half the kids who you really wanted to pay attention to, because another 300 kids were missing because of the combination of excused and unexcused, or just maybe excused absences. And then here in San Francisco, we actually noticed that chronic absence seemed to improve in the middle schools. I will say to you that that is actually an undercount, because in middle school, that's when we start saying, well, if a kid's there 1 period, then they count for their being a day. Now, some school districts have a more complex analysis, but when we're looking at average daily attendance, using that data, we're actually often undercounting kids, because there might be a kid who's missing a lot of periods, and that isn't being noticed because they're still showing up one period, or maybe there are challenges with attendance taking. But we ought to be looking at how many kids are missing so much school that they're academically at risk. So we know that in middle school, it's a bit of an undercount. It may even be a bit of an undercount in high school. But we also know from this curve that truancy and chronic absence start to mirror each other a bit more. But I will also tell you, the kids who are really highly chronically absent in kindergarten, if you don't help to improve their attendance, they are likely to be the same kids who by middle and high school are now chronically absent, but maybe it's due to more unexcused absences. This is a pretty classic curve, and it gives us some insights about when we can really start to make a difference. One of the reasons that chronic absence is missed so easily is because a lot of times absences aren't consecutive. Maybe they're a day here, day there, you know, and families as well as teachers may not notice. The challenge and our opportunity is that we have to advance a new attendance paradigm. We have to move from truancy, which only looked at unexcused absences, thought about attendance as a matter of compliance, typically looked at legal, more blaming, punitive solutions, to looking at chronic absence. These aren't mutually exclusive, but if we want to engage in prevention and early intervention, we have to look at all absences. We have to recognize this is about opportunity to learn. And when you're not in school, then there's an academic impact. And it doesn't matter why if you're missing that much school. And it means that we have to engage in prevention, problem solving, trauma-sensitive approaches. And we have to see that, as Manuel mentioned, this is about engaging families and students, because they have to be partners in both understanding what keeps kids from getting to school and implementing solutions that will get them to school. And why do we care about this? It's because we now have a wealth of research that shows when kids miss too much school, starting in pre-K and K, it can affect reading at 3rd grade, their ability to pass middle school classes, their ability to graduate and not drop out from high school. And you know, there's even research that maybe there's a few kids who somehow manage to be chronically absent in high school and still graduate, but those kids are less likely to persist in college, because at some point, having the habit of attendance is just critical to success. Showing up truly is half the battle. And this is just another way of seeing that same data. Chronic being there gets you all the way through that pathway to success, and not being there has an impact on your academic success throughout your academic career. And we can see this research. If this is actually research on kids in in preschool in the Chicago public schools, these are all low-income kids. But the kids who were never chronically absent were fine, according to their DIBELS fluency exams in 2nd grade. The kids on the far right at 7 to 2.9 on their DIBELS scores were the kids who were chronically absent pre-K, K, 1st and 2nd. Chronic absence in kindergarten can predict lower literacy in 1st grade, lower achievement in 5th grade, and suspensions in middle school. And this is chronic absence in kindergarten, when you follow a group of kids all the way out. We know that if kids are chronically absent in K, and then they aren't showing up in 3rd grade, and even if often attendance improves in 3rd, if you haven't learned to read, you can show up in 3rd grade and still fall behind. And then by the time you're in middle school, where your families may be relying upon you more as a child, as a young person, to get to school, and you don't like school because you can't keep up, you might be truant, or maybe you'll act out. The data really reflects what we know from common sense. And we know that for high school, chronic absence starting in 8th grade really predicts dropping out. You miss too much school in high school, even for like 1 grade. This is where learning is, you know, algebra, chemistry, any of those academic courses that are so key to going on to college. You have to show up. Otherwise, you quickly fall behind And even if you're, and if you don't catch it early, it's really hard to catch up. And the most vulnerable kids are affected the most, because those living in poverty are more likely to experience chronic absence in earlier grades, when it's not just a matter of what's happening with a kid, but if a family member has a health issue, if housing is challenging, if transportation is challenging. Our youngest kids need help getting to school. So if the people who are their parents, caregivers, family members who help them get to school have challenges, then they can't get to school. And they are much less likely to have the resources to make up for the lost learning time in classroom. And when kids face these systemic barriers of health, housing, or even schools, which are unfriendly and unwelcoming to people who are like them, they're more likely to experience multiple years of chronic absence. So let's look a little bit at chronic absence data and what it means here in California. So first of all, this is now a part of our accountability metric, and this data. I will say when we first started in 2008, actually before the launch of Attendance Works, I couldn't even convince people here in California that they needed to look at chronic absence data, because we thought, because we had average daily attendance, that we were looking at all the education metrics. But now we realize we aren't. And after a long time of advocacy with many, many people, by the way, our work isn't because of Attendance Works. Our work is because we have so many allies in the field who help move this work together with us, including, I'm sure, many of you who are in this webinar. But now we have this data in the Data Quest. It's publicly reported. It's on your dashboards. This is an example of our data from Data Quest, which is showing how chronic absence, in fact, is really contributing to our equity gaps. Incredibly high levels of chronic absence among our Native American, African American, and Pacific Islander kids. And we sometimes, actually, we've seen some growth in, unfortunately, I think there are some real challenges happening around education, safety, security in schools, though we still also know that this is all things that can be addressed. But we know this really is a significant issue here. And we know that it is a significant issue for many of your schools. It varies a lot by school, but you have some places with particularly high rates. This is actually your district rates. And within your districts, you might have schools, the variations in your rates from low to extremely high within your district. So it's always important to look at your data and look at it using chronic absence, not just truancy, not just average daily attendance, and then looking within a district to see if there's disproportionate populations or schools where chronic absence is a challenge. The good news is that we know how to address this. It is about taking a systemic approach that involves, we have this shared accountability here in California. And while I think our Data Quest data gives us some actionable data sort of for end of the year planning, what's really exciting to see is the growth in districts who have more actionable data that can make sure that there's accurate data that's accessible, regularly reported, like sometimes in real time, sometimes at least once a week, that people can look at and act upon, because they can notice as soon as possible when kids are starting to miss school, so they're academically at risk, or notice as soon as possible when you have a troubling trend in a particular school population, or a promising trend that might allow you to know when you have a bright spot that could be addressed. And you can use this actionable data to see where you need to build capacity around positive engagement, and where you might need capacity to engage in strategic partnerships to address the barriers that keep kids from getting to school. Reducing chronic absence really requires being able to understand why kids miss school. Now, we talk about that you can look at barriers in these buckets. There's the barriers that are often connected to what's happening in communities: illness, lack of health care, family responsibilities, trauma. By the way, there's almost research on every one of these about how these kinds of issues can affect kids' school attendance. For example, a kid with 2 or more ACEs scores can actually shows higher levels of chronic absence. That's not terribly surprising. That's why you have to have a trauma-informed approach where you ask kids what happened, not what's wrong with you. We have data that shows, when kids have lack of health care, there's different chronic illnesses that can really affect attendance. Then we also know there are things that happen that are negative experiences in schools that can drive chronic absence, whether it's bullying, harsh disciplinary practices, or maybe parents themselves had really negative experiences. This is one of the things I see, particularly among Native American student populations. You're not entering a school to family relationship that's a blank slate. There's a history of negative experiences where schooling was used to sort of take away the culture and the language of Native American families and their children. And in order to address and improve attendance, it means you have to actually assure Native American families that school is really helping children to both honor who they are, as well as learn about being in mainstream culture and learn about other learn academics. And then, and this is sort of an example of how, if you want to address chronic absence, you have to know which of these barriers is going on. Is it illness? So if, for example, a kid has is suffering from asthma, you can't just address a misconception, which is also a barrier, saying, hey, do you know that your child missing 2 days a month is a problem? You'd have to say, hey, I know your kid has asthma. We're really trying to reduce asthma triggers. We're really trying to make sure that we have a plan for addressing if your kid has an asthma attack. And that's because just missing 2 days a month can affect learning. And partnering together, we can prevent these health-related barriers. What we know is that improving attendance requires knowing what are the barriers, what are the negative school experiences, whether it's about creating a more engaging school climate or addressing these misconceptions. When you know what those barriers are, you can come up with effective solutions. That said, we also see that there are frameworks that allow us to both unpack barriers and support attendance. And that's by taking a tiered approach. And many of you are already using tiered approaches, whether it's part of school climate, MTSS, RTI. And this is not saying you should create yet another totally different tiered approach. It's integrate attendance in whatever tiered approach system you're using and take a holistic approach to working on this in your schools and districts. And tier 1 is really about prevention. It's about making sure that you have an engaging school climate, that you're building positive relationships with students and families, that you're helping people understand the impact of absences and what they missed when they weren't in school, that you're monitoring your data, that you're recognizing good and improved attendance, not just perfect attendance, because that tends to not motivate the kids who've been challenged to improve, that you're seeing if there's common barriers, that you're addressing them. And then you're using your data to really understand where you need personalized outreach, where you need to create more tailored action plans, where a caring mentor can make a huge difference. And then you're looking at tier 3 to make sure you have a coordinated interagency response for those kids who are missing a lot of school and probably have multiple challenges. And keep in mind, this is additive. The kid in tier 3 needs tier 1 and tier 2. And at the same time, what this triangle, this pyramid suggests is that when you have very high levels of chronic absence in a school, 20, 30, 40%, or in a population of kids, it means that tier 1 isn't in place. Sometimes we think that improving attendance is a matter of just social workers and truancy officers, and it's not. Improving attendance is really something that happens when the whole school working together ensures this tiered approach to making sure kids want to be in school. When you have high levels of chronic absence, again, for a kid, for a population, for a school, it is an indication that these kinds of positive conditions for learning aren't in place. And what I mean by positive conditions for learning is that kids feel physically and emotionally healthy and safe, that kids feel a sense of belonging, connection, and support. They feel academic challenge and engagement, that the adults and the students around them know how to support these positive conditions of learning. And relationships are an essential component to each one of these. If you have positive relationships with people in a building, you're more likely to feel emotionally healthy and safe. You're more likely to feel belonging and connection. When your teacher is someone who cares about you and knows about you, they're better able to make sure that what you're talking about in the classroom engages you and is challenging for you. They can better personalize your learning. And when adults and students can support that learning, it really reinforces all of these. At the same time, we know that sometimes the reason these things don't exist easily can be what's happening in the broader environment. We have real challenges. The public charge issues where families are scared of using even benefits that they can use, whether it's free and reduced price lunch or certain health benefits, because they're worried, and the fears they might have around that could make kids not feel physically and emotionally healthy and safe. And then it means that schools have to even do more to create that positive, engaging environment. And this is, again, where a high level of chronic absence can be used for thinking about where are strategic partnerships. Because maybe, for example, providing healthcare can be done in partnership with your local community clinics, which I know does happen in some of the places in the Fresno area. And it's those high levels of chronic absence, either for a kid, for a population, or a school, that help you notice when do you most need to have partnerships. I know schools, I don't want to, schools do so much already. I'm not trying to add to the burden of schools, but schools are the places where our children and families can be found. So you're the first line of prevention and early intervention. And when we have data, it helps us to know when we need to add reinforcements to ensure a school. If you, for example, part of the physical and emotional health and safety isn't there because of trauma in the community, it means that we even more have to equip a school to be trauma informed, because you can help to almost bolster against challenging community conditions if we use our data in the right way, so we can have those partnerships that enable you as schools to put in place positive conditions for learning. Learning, these conditions are push and pull. If a child feels ignored and unsafe, or bullied, or bored, or not treated fairly, they won't show up. And if the conditions outside the school, poor transportation, are hard, they're even less likely to show up. But if you feel cared for, safe, and belong, when you feel engaged, when school's a place where your family can get supports, that makes you show up to school, even when the external environment is tough. And we know that some kids, those kids who are, particularly we think about them, this works for both moderate and severely chronically absent kids, but with moderate kids, this might, and that's kids missing 10 to 19%, this might be sufficient. If you assign a caring mentor who maybe greets the child 3 to 5 days a week to connect in with them, that can also be part of Check and Connect. Have an attendance plan, connect a child to engaging before after school activities versus just making sure after school is going to whoever first signs up for them, but use chronic absence data to recruit kids who might most benefit from it. Have a walk to school companion. Make sure that chronic absence is connected in with an IEP plan. Make sure a kid who's chronically absent has connections to health supports. These kinds of interventions can help moderately chronically absent kids not become chronically absent kids. They might also help improve the challenges for the severely chronically absent kids, kids missing 20% or more that we often see, but alone they may not make enough of a difference. and we think about those tier 3 kids, again, the kids who are missing 20% or more, these are kids who might already be involved in a system. They are families who might feel hopeless because of the barriers they've faced. Often there's a higher percentage of kids with disabilities. These are families who you really have had negative experiences often with schools or systems. So you really have to engage in positive, loving outreach to get them to want to have these supports. And that's when you really need to bring in those extra resources in your community, in your school community and in your external community, and then combined together, you can work on tier 3. But just to remind you, tier 1, though, is something that is within the power of schools. And if you don't do tier 1, let's say I've known of, we had colleagues working with kids who were in the child welfare system who talked about why they thought it was so important to have tier 1 in place, because even though they were getting kids who were coming out of the foster system to come to school through intensive case management, they were working uphill, because when the kids in the foster care system got to school, they were feeling alienated by the school environment and not having positive relationships with students. And when we put in place tier 1, when we invest in prevention and early intervention, that's what allows us to decrease the numbers of kids who need tier 2 and tier 3. So then we can direct our resources. We have more resources to do the more personalized outreach, the more intensive case management that might be needed in tier 3. So with that, I actually get to turn the mic over to Cecilia and have Cecilia talk about what we're going to be doing in this community of practice.
Thank you so much, Hetty, and good morning, everyone. We are really looking forward to the opportunity to get together with all of you and your colleagues. First up, we're asking you to save the date. I already saw questions about how do we sign up for this wonderful opportunity. So we will be sending you registration information later after this webinar. But for now, save the date, January 23rd. We will be in person at the DoubleTree, and this is really an opportunity to go deeper together. You'll get to hear from Hetty and the rest of the Attendance Works team on the 23rd about what we're seeing across the country that really works to address chronic absence. We'll go more in depth into the tiered framework that Hetty introduced to you today. And I really want to highlight the fact that there's a lot of great work going on in the Central Valley and in Fresno County in your districts. And so this is an opportunity both to hear from peers at the local level, as well as get great ideas from other communities outside the Central Valley. And that there'll be lots of opportunity for you to work in teams to digest what you're hearing, and also to share across communities. So do spread the word. Put this on your calendars and look for the registration links when it comes out. And I do get to say my favorite 4-letter F word again, which is it's all free, thanks to our partnership with REL West. So registration is free, parking is free, the materials are free, even the meals are free. There's such a thing as a free lunch. So I want to encourage all of you to come and bring your friends and your colleagues. Next slide. So the January 23rd event is open to all, and it kicks off an invitation to a deeper community of practice, because it doesn't just take one event or one workshop to really come up with our built out comprehensive strategies for addressing chronic absenteeism. And so some of you will be invited to participate in a community of practice. This is a virtual community of practice that will kick off in March. Prior to that, you'll be invited to apply with your school team and your district team to participate. So the 3 sessions, the dates are on here, March 11th, May 6th, and August 19th. And we'll focus first on building effective teams at the school level. to improve attendance and reduce chronic absence. After that, we will focus more on the key Tier 1 and Tier 2 strategies, which Hetty talked about and which are so essential to reducing high levels of chronic absence. And finally, we'll look at early prevention, how we can work with families to build habits of good attendance from the very beginning in kindergarten. So in between these sessions, we'll also have office hours where if you have questions, we certainly can address those particular ones. So I invite you to join us on the 23rd and really consider the opportunity that the virtual community of practice offers you. So thank you for that, and I will turn this over to Beth Ann for questions.
Great, thank you, Cecilia. So I've been doing my best to monitor the chat, but I know Molly, you're also monitoring. So if there's a couple of questions to get us started, that would be great. And feel free while we're responding to this to chat away and send us your questions. I did see that there was a question regarding the community of practice, and there was a particular interest in, will there be a forum to share ideas? So the way the community of practice is set up is that there will be these 3 interactive webinars, which will be kind of training in focus. There will be pre-work and homework, meaning come prepared and be prepared to implement some of what you're learning in the webinars back in your schools and districts. And in between each webinar, there will be office hours or consultation time for people to meet through a video conference system to share challenges, to share successes, to get deeper coaching from the Attendance Works team. So that's super exciting. I just saw on the chat the time frame for the day on January 23rd. There is a hard start time. I believe it's 8:30.
That's correct, Beth Ann.
And we are very mindful that people come from all over Fresno County, and so we are adjourning at 3:15, so people have the opportunity to get home in time to pick up kids and get dinner ready and all that good stuff. I also saw a question, will these slides be available to everyone? Yes, yes, yes. So we have recorded this webinar. I think as early as next week, we will be able to send you the webinar and slides. I also see that I already answered that question. Okay, I'm getting pinged about a question. I'm on it. So yes, the webinar will be archived. You will have these slides. I want to underscore, there's lots of questions about January 23rd. We will be getting out a registration link soon, possibly as early as next week, but soon, I promise. And I just wanted to add, if you've never been to an event led by the Attendance Works team, you're really in for a treat. Their full day trainings are highly interactive. There's great content. You're going to have local data to muck around with. The activities are going to be very well facilitated. There's going to be lots of opportunity to process and ask questions. And I do think one of the high points, as Cecilia underscored, is that there's lots of really good work going on in the Central Valley and in Fresno County in particular. I know because I'm working very closely with a couple of districts. And there will be some panels where you get to learn from your colleagues about some of the most promising practices that they've been able to employ in their districts. So that's always a highlight for me. Let's see, Molly, did I miss a question or two somewhere?
I think you're caught up.
Okay, I think there was some interest, and I'm hoping that someone on Attendance Works can address this. As people take this information back and recruit colleagues to join us on January 23rd, it is not a requirement on January 23rd to come with the team, although that would be great. It is not a requirement that you come with anyone from your school or district, although the more the merrier. We have room, as Manuel mentioned earlier, for several hundred people. So don't worry about bringing 20 or 30 people. Please come, bring them. But I would like someone from Attendance Works to take just a minute to describe the roles that make up a strong attendance team. So as people go back to their schools and districts, they can think about who to really recruit to join us starting in January 23rd and maybe to join the community of practice.
Beth Ann, this is Cecilia. I'd be happy to answer that.
Thank you.
So I think at the school level, it's really important to have an administrator who leads the work, because we know how schools operate. You really need that strong leader to make it a priority. But in addition, you want to have the people on a team who are going to be able to help you implement the strategies you come up with. So there's no team and I, so you don't want just one person, but you want the people who are able to track your attendance data, like your school secretary or your attendance clerk. You want the people who know how to engage with families. So you may want your family liaison, you may want someone who's able to speak the home languages of the families, and you want people with specialized skills to address some of the reasons why kids are missing school. So it's health related. If you have a school nurse or a health worker or a community partner that addresses health, that would be fabulous. So that's when we think about a team, it's really about who can help do the work and put the strategy together and execute it.
Cecilia, I was also going to add on to the health piece, because I really appreciated Terry for also mentioning in the chat about the health absences can be a challenge. And certainly we see that health ends up being the most typical reason that families with young children say their kids will miss school. I also wanted to mention, and this is something we can share in the forum, that the American Academy of Pediatrics has just, in last February, put out a position statement talking about how pediatricians can help with addressing attendance, both by asking about the question and also encouraging pediatricians to take a hard look at when kids may be experiencing, certain kinds of health, physical symptoms that are actually related to anxiety, and then also helping families to understand that, even if absences are excused, they can add up to too much. So you want to prevent excused related, even health related absences. So that's the kind of thing we certainly can do at the forum, because we can equip your health providers too that are connected with schools to think about how they reach out to community health providers who might be able to help play that role. And certainly the AAP statement is the kind of tool that is really helpful for all of us.
Great point, Hetty. And Terry, also, just so you know, we have one of the presentations includes telehealth and teledental. And so having that additional strategy to reassure families that their child is well enough to stay in school, or to do a real assessment and determine when they should go home, that's something we'll be covering on January 23rd as well.
Cecilia, can I also just note something? I know that there are some folks, I think, from the registration list who might also be dealing with high school or older kids. And it's interesting because one of the things that I also see is that when the little ones get sick and the parents have to work, it's the high school kids that get end up staying home too, because someone's got to be home with the little one. And so some of this actually, goes across generations, and it's not always that. Sometimes you can actually, address two issues at one time.
Great, thank you. I'm not seeing any other questions. Feel free to send us a question in chat, but just by way of wrapping up, yes, mark your calendars for January 23rd, and you will be hearing from us very soon with a reg link and an archived version of this webinar and PowerPoint for you to use. One of the ways that we can continue to be responsive to the needs and interests of folks in Fresno County is to hear directly from you. We host a number of convenings there. We're super excited to be hosting the event on January 23rd. But one way we make sure that what we do is really in line with what you need is to hear from you. And so we've put in chat, you can see Dan Wilson, one member of our team, put the Survey Monkey link in there. Please complete the survey. It's just a 1-second survey, and that feedback really helps us to plan. Your comments really matter to us. And with that, I think it's time to say thank you so much for joining us today, for your commitment to students. And we look forward to seeing you after the winter break on January 23rd. So bye for now, and have a wonderful rest of your day and Thanksgiving holiday next week.